Welcome to the deep dive. We deep dive into a subject you're curious about.
Right.
And today we're taking a look at immune checkpoint therapy for cancer treatment.
Okay.
And we're going to be using this article from Assay Genie.
Mm-hmm.
It's called Targeting Immune Checkpoints as Cancer Therapy.
Right.
So what's really fascinating about this is that instead of going after the cancer directly, this therapy empowers our own bodies to kind of do the heavy lifting.
Yeah, that's exactly right. It's
Yeah.
really about harnessing the power of the immune system, which is our body's natural defense force.
Okay.
You see, the immune system is always on patrol, identifying and eliminating threats.
Okay, so then why doesn't it just obliterate those sneaky cancer cells? I mean, you'd think that would be priority number one.
Well, it's not quite that simple.
Okay.
The immune system is incredibly complex.
Right.
It needs to attack invaders, but it also has to avoid harming our own healthy cells.
Okay.
It's all about balance.
Right.
And cancer cells are unfortunately masters of disguise. Okay, so they're not just growing out of control, they're actively hiding from our defenses.
Exactly.
That's pretty devious.
It is. They exploit these things called immune checkpoints.
Immune checkpoints.
Yeah. Think of them as communication channels that cancer cells can hijack to trick the immune system into thinking they're harmless.
So they're like sending out a fake ID, making the immune system think they're a friend, not a foe.
That's a great way to put it.
Okay.
And this is where immune checkpoint inhibitors come in.
Okay.
These drugs are like cutting off the communication lines, finally exposing the cancer cells for what they really are.
That's pretty ingenious, actually.
Yeah.
So, but how do these inhibitors actually work on a practical level? Are we talking about a pill, an injection, what?
Well, there are different types, but they all target those immune checkpoints, essentially taking the brakes off the immune system.
Okay.
So it can attack the cancer cells.
Gotcha.
The article specifically highlights two key pathways.
Okay.
PD-1, PD-L1, and CTLA-4.
These are like the main communication hubs that cancer cells exploit.
So the drugs are basically like jamming the signals on those pathways, preventing the cancer cells from sending their fake all-clear messages.
Exactly. And there are specific drugs that target each pathway.
Okay.
For example, pembrolizumab and nivolumab target the PD-1, PD-L1 pathway, while ipilimumab targets CTLA-4.
Okay.
These are just a few examples, and the field is constantly evolving with new drugs being developed all the time.
Wow. So there's a whole arsenal of these drugs being used to treat different types of cancer.
That's right. And one of the most exciting things about these drugs is their specificity.
Okay.
Unlike chemotherapy or radiation, which can harm healthy cells along with cancer cells,
Right.
these therapies are much more targeted, focusing on the immune system itself.
That sounds incredibly promising.
Yeah.
So are we talking about a cure-all here? Is this the magic bullet we've been waiting for?
Well, it's important to be realistic. While immune checkpoint inhibitors have shown remarkable success in treating certain cancers, it's not a cure-all. Not everyone responds to these therapies, and there are still challenges to overcome.
Okay, so it's not a perfect solution. The article mentions some of those challenges, right? Like the fact that not everyone responds the same way.
Yes, there's a lot of variability in how individuals react to these treatments,
Right.
which is something researchers are still trying to understand.
Okay.
One theory is that it has to do with something called biomarkers.
Biomarkers.
Yeah.
That sounds familiar, but remind me, what exactly are those?
So imagine biomarkers as tiny clues within our DNA that can tell doctors which treatment will work best for each patient. They can indicate whether someone is likely to respond to a particular therapy or not.
So finding these biomarkers could be the key to personalizing these treatments even further.
Exactly.
That's pretty incredible. But back to those challenges, what other hurdles are there?
Well, another challenge is that cancer cells can become resistant to these drugs over time.
Oh.
Similar to how bacteria become resistant to antibiotics.
It makes sense.
It's a constant battle.
So we're essentially in an arms race with cancer cells, trying to stay one step ahead.
That's a good way to put it.
That makes sense.
Yeah.
What about side effects? Are we talking about the same kind of harsh side effects as chemo?
Well, because we're essentially supercharging the immune system,
Yeah.
there is a potential for immune-related side effects.
Okay.
These can range from mild to severe and are something doctors monitor very closely.
So there are definitely some drawbacks, but overall it sounds like the benefits of these therapies could outweigh the risks for a lot of people, especially if we can figure out how to personalize these treatments even further. What's on the horizon for that?
One promising area is combination therapy. Imagine using multiple checkpoint inhibitors together, each targeting a different pathway. It's like hitting those cancer cells from all angles, overwhelming their defenses.
So it's not just about finding the right drug. It's about finding the right combination of drugs for each individual.
Precisely. And researchers are also exploring completely new checkpoint targets.
Wow.
The more we understand about the intricate workings of the immune system,
Right.
the more opportunities we have to develop even more effective therapies.
That makes sense.
Yeah.
The article from Assay Genie actually mentioned some pretty specific examples of cancers that are already being successfully treated with these therapies, right?
Yes, melanoma, lung cancer, renal cell carcinoma.
Uh-huh.
These are just a few of the cancers where immune checkpoint inhibitors are making a real difference. And it's not just about treating these cancers. It's about improving survival rates and giving people more time with their loved ones.
That's got to be incredible for patients and their families. Yeah. It sounds like we're on the verge of a real paradigm shift in cancer treatment. But I'm curious, what does this all mean for the average person listening right now? Maybe someone who's not a scientist or directly impacted by cancer.
I think the key takeaway is that this is a field with tremendous potential. Even if you're not personally affected by cancer right now, understanding these advancements can help you be a more informed citizen. You can engage in conversations about healthcare policy support funding for research and spread awareness about these groundbreaking treatments.
It's about being an advocate for scientific progress, even if you're not on the front lines yourself.
Yeah.
That's a powerful message. But let's bring it back to the personal level for a moment. What advice would you give to someone who is facing cancer and wants to learn more about these therapies?
First and foremost, talk to your doctor. They can help you understand whether these therapies are right for you and what the potential risks and benefits might be. Don't be afraid to ask questions, do your own research, and be an active participant in your own healthcare decisions.
That's such important advice. Knowledge is power, especially when it comes to something as complex as cancer treatment. But beyond the science, I imagine there's also a huge emotional component to all of this.
Absolutely. A cancer diagnosis can be incredibly overwhelming and frightening. It's essential to seek out support, whether it's from loved ones, support groups, or mental health professionals. You don't have to go through this alone.
That's so important to remember. It's not just about fighting the disease, it's about taking care of your mental and emotional well-being as well.
And speaking of well-being, I think it's also worth mentioning that lifestyle factors can play a role in cancer prevention and even treatment outcomes. Things like diet, exercise, and stress management can have a significant impact on overall health.
So it's about taking a holistic approach to health, recognizing that it's not just about the medications or treatments we receive, but also about the choices we make every day.
Exactly. It's about empowering ourselves to take control of our health, both proactively and reactively. And while immune checkpoint therapy is a powerful tool in the fight against cancer, it's just one piece of the puzzle.
Well said. So we've talked about the science, the challenges, the successes, and the very human side of immune checkpoint therapy. But before we wrap up this deep dive, I want to leave our listeners with a final thought-provoking question, something to ponder as they continue exploring this fascinating field. The article mentioned how this whole field of immune checkpoint therapy is paving the way for more personalized cancer treatments. And that got me thinking, what does that future actually look like? What if we could tailor treatments to each individual's genetic code, their specific type of cancer, even their lifestyle? Almost like designing a custom weapon against their disease.
It's a question a lot of researchers are trying to answer.
Yeah.
Imagine a world where cancer treatment is no longer one size fits all, but a finely tuned combination of therapies working in concert with the body's own defenses.
It almost sounds like science fiction. But then a lot of what we've discussed today probably sounded like science fiction not that long ago.
Yeah.
Think of the possibilities: fewer side effects, higher success rates, maybe even a future where a cancer diagnosis doesn't carry the weight it does now.
It's definitely a future worth striving for. Immune checkpoint therapy isn't a magic bullet, but it is changing the game, and research into the complexities of the immune system is opening up so many new possibilities.
Yeah, that's what I find so fascinating about science. It's a constant journey of discovery, pushing the boundaries of what we thought was possible. And in the case of immune checkpoint therapy, that journey is filled with a lot of hope.
Absolutely. And for anyone listening who wants to delve deeper into this topic, I encourage you to check out organizations like the Cancer Research Institute or the American Association for Cancer Research. They're great resources for staying up to date on the latest breakthroughs and advancements.
That's great advice. It's so important to be an informed patient or advocate. So to wrap things up, we've gone from the basics of the immune system to the intricacies of cancer cells and the revolutionary potential of these new therapies. What would you say is the key takeaway for our listeners?
I'd say it's the power of knowledge. Understanding how these treatments work, their potential benefits and limitations, can empower people to have more informed conversations with their doctors, advocate for themselves, and ultimately make the best decisions for their health.
Well said. And remember, even if you're not personally affected by cancer right now, this knowledge can help you be a better advocate for others. Share what you've learned, spread awareness, and support research efforts.
Exactly. It's a collective effort, and every voice matters.
And on that note, we'll wrap up this deep dive into immune checkpoint therapy. We hope you've learned something new and are feeling empowered to continue exploring this incredible field. Thanks for joining us on the deep dive.